Today, I'm talking to Dave Casimiro, Executive Vice President at Vital Infrastructure Property Trust and one of Canada's most respected healthcare real estate leaders. Dave built an extraordinary career within one organization, joining Northwest Healthcare Properties REIT in 2006 as a leasing manager and rising to EVP as the company evolved into today's Vital Infrastructure Property Trust. In his current role, he works alongside the CEO and Board of Trustees on a long-term strategy across medical office buildings, outpatient facilities, and specialty hospitals, with a hand in everything from portfolio strategy to healthcare partnerships and growth. Today, we're getting into what 6 years of leadership has taught him since we last spoke on the podcast, the transformation from Northwest Healthcare to Vital Infrastructure, how a significant personal health challenge reshaped his view as both a leader and a patient, and why healthcare real estate is becoming one of the most compelling asset classes in North America today. Dave, welcome back to the podcast.
Thank you, James. Very happy to be here.
6 years ago, we sat down together for the first People Who Perform podcast. And at the end of that conversation, I asked you where you hoped that you would be in 5 years' time. And you said that you'd hope that one day we'd sit back down and we would see whether you had achieved those goals that you set out to accomplish. Well, here we are, and let's start there. So your career, since 2020, you progressed from SVP to Managing Director of Canada, MD of North America, and now EVP. Tell us about where you are today and what has been the journey since we last spoke.
Thanks, James. It has been a journey. I think that's a great way to put it. Pretty exciting times for me professionally, being part of the organization as we've pivoted to more of a growth mode, and obviously having an opportunity to leverage my 20 years of, I would say, real estate and operational experience, and utilizing that skill set and those relationships to work more closely with some strategic partners in building the business and the relationship side of our business on how and where we want to grow. A bit more outward facing, and obviously I've had much more of an operational background over my career, which clearly still work very closely with our leadership team and our operational team in supporting them and a number of initiatives, but definitely spending more time outside of the day-to-day or the weeds, as we like to say, and look at more big picture real estate strategy, partnerships. And with that comes the opportunity to work really closely with our CEO, who's just recently joined the organization, actually just about a year or so ago, and learning from him and having the opportunity to articulate my experience and sort of the business to him, introducing him and traveling a bit with him to familiarize himself with the team and the assets and the markets. And in with that, being more closely aligned on, the direction of the organization, spending more time with the board, having their support in how we are looking at continuing to evolve and grow our business.
Now, on the last podcast, you talked a lot about relationships. We talked about mentorship. We talked about continual learning. How has your definition of leadership changed since then?
We've just spoken about transitioning into this role. I've really come to appreciate and had to learn the ability to transition items off and trust other leaders in the organization in areas where I've spent a lot of time, to then be able to focus myself and my initiatives on other aspects of the business. So that element of trust, I think it's easy to say and a bit more challenging to actually enact that trust. We've got a great team who want to step up and want to take on more responsibility in areas, as I said, that I've spent a lot of time sort of overseeing. So passing the baton and transitioning that out has helped me become a better leader in this organization, because it not only has it allowed me to focus on other areas where I can add value and perspective, it's also allowed these individuals to step up and take on and grow as leaders themselves. It's not to say that we had a distrusting organization. It's just more about letting go and handing off and letting them step up and put their imprint on that relationship, on that vertical, on that function. And so
Hmm.
I can't help but feel it's continuous learning as always. But that's definitely been a big shift in my mindset around what leadership means.
Yeah, it's interesting because it's almost the opposite of what perhaps people expect leadership to be about in their career, when it's often more about authority or having the answers. But yeah, I mean, trust takes time to build, but it compounds, right? Once your team and your leadership trust your judgment, you can move faster, you can delegate more, and you can actually focus on the bigger picture instead of just being stuck down in the weeds. What do you value more today in terms of relationships, mentorship, learning, leadership?
I continue to hold a very strong and high regard for the importance of relationships, internal, external. It, it it is fundamental to our business, and so I'm not suggesting that one approach to a relationship sort of wins or matters. There can be multiple approaches, but really not losing the focus on what we're doing and who we're doing it for, and our tenants. These relationships, from a tenant perspective, tend to be long term. So we have to approach it and treat them on a long term basis.
And I think you can see that play out at the business level too. I mean, tenants are long term in healthcare real estate, right? So that, I mean, that same philosophy of relationships and trust isn't just about a leadership style. It's actually baked into the model of the business, right?
Correct.
The people side and the business side, they reinforce one another, I guess you could say. So how does today's Dave compare to the one who was sitting opposite me in 2020?
A little slower, a little grayer, but maybe a bit more refined. I would say that obviously there's we can joke around here a little bit, but in all seriousness, there are ups and downs. And for those who know our organization, would know that we have and come out of a pretty challenging time organizationally. We're in, obviously, with pivots and changes in the market. We were led to looking at downsizing and sort of exiting some of our portfolio, which obviously impact people. But I'm quite happy to share that is very much in the rearview mirror. Definitely have turned the corner and moving in a different direction. And I know that the continued focus of our organization is to execute on the strategic initiatives and what we've been communicating more broadly to the market, and with the fundamental belief that we will be rewarded for it. It's nice to be talking about growth and actually growing, as opposed to needing to contract, not only in
Mhm.
assets but with people. And
Mm.
obviously, I know you're very much invested in the people side, James. And so it's a great time to be part of an organization that looks at and is excited about growing again.
Slower, grayer, more refined. Were you describing me or were you describing yourself there?
Sounds like a nice wine or a vintage port.
Oh, well, seriously, I mean, what you're describing is real growth, right? Not just time passing, right? You've been through the ups, you've been through the downs, you navigate some genuinely challenging stretches. There were some pivots and market shifts and even some difficult decisions, as you mentioned, around the downsizing the portfolio that would impact people directly. And that's not easy to sit in. But the fact that you can look at it in the review mirror now and speak about it with that perspective, I think it says a lot about the growth through it and not just around it.
Exactly.
What sort of building on that? What didn't go according to plan? If we were to go a little bit further into the weeds on that.
Well, if we're referring specific to the work environment, I can share that we got caught in a time, maybe spread ourselves a little too thin. We're a big organization, dispersed across a number of geographies, and very complicated business, which we're looking to simplify and focus on now. Hence the description of how and why my role is transitioning to focus on some of those strategic real estate strategy and partnerships. But I also say that between our last podcast and the one today, I've also experienced other challenges on the personal side that I know we'll get into a little bit here. But never a dull moment, James. And I'm a glass half full kind of guy, and sort of integrity is important, and try to find ways to make the best decisions for those who are impacted and involved. And I'm happy to be here today with Vital, focusing on growth, focusing on building our brand, focusing on growing our team, and working to support our organization more broadly.
It's an exciting time and journey ahead. Now, the last 6 years wasn't just defined by promotions and personal growth, and life also threw you a challenge that no one plans for. Last year, you experienced a significant health challenge that resulted in surgery, months of rehabilitation, and you're off work for over 6 months. How challenging was stepping away from work and also stepping back into work?
It was probably one of, if not the most difficult time. As you mentioned, obviously it sustained an injury requiring surgery that limited my ability to work. So stepping away was extremely difficult. And I think that if I just touch upon what I had mentioned earlier around trust, that was really and transitioning items, that was really the catalyst for it. Because before I was off, obviously very busy time, lots happening in the organization, and having the support of the organization to take the time and fully step away, I'm extremely grateful for. It allowed me to obviously focus on myself and on regaining my health, and getting back into the physical condition that I need to be in to live a full and successful and enjoyable life, and including career growth and aspirations, not just on the personal side. So it was very difficult because, as I say, the organization supported me, which I'm grateful for, but I completely cut off. Right, I just had a couple of touch points over the time that I was off with certain members of the team, just to check in. But essentially, what I had been used to and accustomed to on a day-to-day basis sort of was no longer there. So that transition was not without challenges, but it has definitely helped me, to your second point, on how my perspective and how I feel and how I approach matters since I've come back. Really working and engaging with the team, having that some of these items transitioned over, being off 6 months and coming back, and now being back for, as I mentioned, just under a year now. Those first few months were very uncertain, very challenging, as I was also in the conversations and discussions around transitioning into this new role. It's like, well, what do you mean I'm not going to do that? That's what I've been doing for all of these years. Oh, no. Now you need you to focus here. So lots in that, but overall, from challenges, you grow from challenges, and take those learnings and that growth and apply it into what you're aspiring and wanting to be moving forward. And they say impact on work is one thing, but I'm also very close with my family, and the impact on them, and ensuring that home base and that relationship side and that foundation is strong, which allows me to then obviously be able to focus here on the organization and my professional growth since coming back.
Thank you for sharing. Yeah, I know it's not an easy one to talk about. And as you said, one of the hardest periods in your life to go through. And when you're sharing, what I'm hearing is there's a piece around letting go in terms of the trust, And there's also another piece around just slowing down when you're just so used to being go, go, kids at home, family, wife, work, team, traveling, moving across the country.
Yep.
You're in that rhythm. And suddenly you find yourself just lying in a hospital bed day after day after day.
Hmm.
That can be, not only incredibly hard from a physical recovery, but also just the mental and the emotional strain of being out of the business, and that really tests that trusting the team and trusting the people you've built relationships with at the exact moment that you had no choice but to to lean on them completely.
Right. Now you're spot on.
I want to bring this into Canadian healthcare, right? Given that that's the asset class that you work in. So, given that you've been in this environment for over 20 years, you got to now experience the system from the other side, becoming the patient. How did that change your perspective on Canadian healthcare?
One of the most difficult parts is, and as a patient experience, as a patient speaking, is I would say navigating the system, James, getting in and understanding where, how you or one should get care. Even today, I think poses challenges. Wherein folks feel that if an ailment occurs, they have to go to the hospital, and then there's a tremendous amount of pressures on hospitals. Wherein perhaps there's a clinic or a physician or a diagnostic center that may be able to provide you with the same level of care, but without having to sort of navigate a hospital system. Once you're in, I don't have anything negative to say about our hospital system. I was well cared for, well treated. Physicians, the nursing, the support workers it was absolutely incredible. It did take sort of a bit of time to figure out what to do with me, as I say. But I'm grateful that once I was in the system, I was able to get the attention and the care that I needed to ultimately result in the outcome. And I feel great. The ailments that I was experiencing are no longer ailments, and having the chance. But my view on the hospitals, with very, very good hospitals, great academic centers, teaching centers, great research, great practitioners, physician nursing. I do continue to feel that the challenge or overwhelming challenge is how to navigate the Canadian healthcare system. That's not just exclusive to hospitals, because there are other areas and obviously channels for obtaining health. But once you're in, I think it's world class. I think we're second to none um, in terms of the level of care that we get.
Yeah, the real challenge isn't the care itself, right? Once you're in, it's getting there, it's knowing where to turn and how you're supposed to access care. And that's exactly the pressure point the system's under, with so many people defaulting to hospitals. But like you said, once you're actually in, you're saying it's a different story. Great nurses, great physicians. I think that's a really important distinction. How do you now view hospitals?
A lot of incredible things happen within those walls.
Hmm.
There is definitely a wave of demand from patients, and if you look at not exclusively just demographics, because obviously with an aging or a baby booming population and the impact that has on the system overall, but just in terms of that front door, and capacity continues to be challenging, and I do feel, as I say, sort of wearing different hats. I do feel that there's an underlying need to acknowledge what those service and care providers are experiencing, right? So you have frontline workers, and there's been a lot of media on this. Frontline workers, and personal support workers, and the physicians who they're the inbound for a lot of emotion. Oftentimes going to a hospital is not pleasant, and so they are sort of the front door of that, and then taken a lot. And so I think as a patient, sometimes that gets forgotten. And I'm not surprised when you hear about, staff burnout or the inability to attract or recruit and retain, workers in the healthcare system, or those who have been historically worked in a hospital or looking to find other places of employment in the healthcare space where it's not necessarily the front door for a big percentage of the population. I would also say, James, I feel that there's a need, and practice what you preach, so to speak, but being an advocate for preventative health
Mm.
versus reactionary health. If we take better care of ourselves, our health system will then be able to take better care of us. And so I think there's a disconnect. I know when we last spoke, obviously with the pandemic, there's still some pre and post pandemic challenges that are working through the system. But fundamentally, I continue to be an advocate for a hospital system. It's just how and will those hospitals work with the broader delivery of healthcare services, across modalities, across spectrums, across geographies to serve the patient population.
Yeah, it's remarkable what goes on inside of those four walls, and often, as you shared, there's a need for acknowledgement, and often there is just little recognition, and people will focus more attention and time on waiting times and the issues that what's not working versus what is working.
Correct.
I think that's something our industry doesn't talk about. And we talk so much on we talk on infrastructure, we talk on the assets, we talk on the square footage, but at the end of the day, none of that really means anything without the people delivering care inside of those walls.
Correct.
Now, you are, fair to say, a pretty active guy, and suddenly you find yourself unable to stand, walk, or even sit comfortably. Months of rehab. What did the experience teach you?
I would also like to categorize myself as an active person, and it's it's quite humbling when you're no longer able to do the things that you're accustomed to doing. So you don't really appreciate what you have until you no longer have it, and so that inability to really move around without pain. So I would say patience, because you got to trust the process. You got to trust the surgeon saying, really buy into that program. Be patient. Day one is tough. Day 100 will be better than day one, right? So just really working through. And in my case, they're super transparent. They told me 18 to 24 months. I'm not at the 18-month mark. I'm getting close, but I feel great. And so there is evidence, and sticking to a program, being patient, and being committed to seeing the program through. Like, the last thing that I want to do is undertake an activity that you know I retract, I re-injure myself, I have to take two steps back after making so much progress. So there is that psychological piece as well. But I say overall patience, because once you having experienced the inability to do what I'm accustomed and took for granted, prior, you just need to sit back and relax and just understand fundamentally what's important, what matters, and where one should be focused. And that's across everything, James. I mean, at home, friends, family, at work, colleagues. It's just that perspective across, because it's easy to be on edge when you're not physically well or feeling well, and it's got to have that level head and that patience.
No, that humility piece really lands. we're both very active guys, and when you take away mobility, it's what are you left with, right?
Yeah.
When you can't move,
Yeah,
and so
exactly.
you really have to sit with that. It's almost like forced surrender, right? As you said, trusting the process, trusting the people that are taking care of you, the surgeons, and just being patient when patience isn't naturally your default setting. I think that's a lesson for a lot of high performers.
You
Only
get
learn
a
the hard way.
rehab program, do the rehab program.
Yeah,
You're told not to do something, don't do it.
yeah,
That's hard.
for sure. And letting go of control isn't weakness.
Yes.
It's
Yes, correct.
actually what gets you through. And it probably also gives you a completely different kind of empathy now for anyone you encounter who's dealing with something, invisible, something you can't just see by looking at them.
Asking for help. It's okay to not know. It's okay to not be able to ask for help. Rely on, people who are open and willing to do so.
What a journey it's been. And the fact that you can just sit here today, healthy or healthier, and reflecting on it with this kind of perspective, I think says a lot. And it really is true what you say. You don't always choose your challenges, but you get to choose what you take from them. And it sounds like you've come out the other side with a lot more patience, a lot more gratitude, and just a deeper appreciation for the people around you.
Are you looking for a specialized recruiting partner to connect you with the people who perform in commercial real estate? At Highview, we partner with some of Canada's leading real estate companies. From national landlords, institutional investors, REITs and service providers, to local developers, third parties, and private family businesses. We are passionate about the Canadian real estate industry and enjoy discussing what's happening in the market. We also provide insight and advice on hiring trends, compensation benchmarking, career roadmaps, networking opportunities, and much more. Visit us at highviewpartners.ca or contact us directly to discover how we can connect you to people who perform.
Now, let's bring this back into the line of business. Your business has gone through major transformation from Northwest Healthcare Properties REIT to Vital Infrastructure Property Trust. And so, for the people who knew Northwest, how would you explain the difference between who Northwest was and who Vital Infrastructure Property Trust is today?
Yeah, no, certainly. I would say that clearly there's this change is very much a rebrand, strategic rebrand focus, and I'll touch a bit upon that. Given what we do, and in the geographies, and obviously with the continued evolution of healthcare funding, spending, demand, and including the need for healthcare real estate, we do feel that our asset class more broadly in our geographies is infrastructure based. If you think about some of the other asset classes and the other areas of infrastructure, this is real estate, I'll say, focused on critical care where it's being delivered. The change from some Northwest to Vital really speaks to that. And I also would say, James, that from a strategic perspective, we historically operated in a number of geographies, global real estate, healthcare real estate owner and investor. And part of our strategic focus now moving forward is really to bring that in and focus in on the Americas, simplify our business. Ultimately, being a publicly traded company, our shareholders like simplification, like consistency, and the vast majority of our shareholders are Canadian. So bringing the story back to closer to home is important, and I feel that has been a significant change, geographically where we're focusing, and how we're looking at opportunities more broadly, as I say, in the Americas. And when I say that, we have obviously a portfolio here in Canada, also in the U.S. as well as in Brazil. Additional assets in other markets, but our primary focus now under the Vital Infrastructure Property Trust will be here closer to home and supporting the needs that Canadians like you and I are facing as the needs of our population and are the challenges in our healthcare sector continue to evolve.
Yeah, it's a meaningful evolution, right? And in real estate, brands get attached to strategy, naturally so. And when that strategy outgrows the brand, you almost have to make that change, or risk people misreading what you actually are, and calling yourselves infrastructure rather than just real estate. I think
Correct.
it's a smart positioning move too. Infrastructure investors think in decades, right? Not cycles. That's a completely different investor mindset, and probably a more patient, stickier capital base for a business like yours.
Yep, and not just on the investor side. If I flip it back to our portfolio, one of the metrics that we sort of publish on a quarterly basis is our weighted average lease expire. We have tenants who stay with us for a long time,
Mm-hmm.
and many of them, especially closer to us here, many of these physicians that we lease space to, they spend their career in our buildings with their practice, or transitioning that practice. So yes, the infrastructure piece, I think, is very strategic as we think about that long-term investor, and that steady approach, that critical nature. But I would also say that from our tenants' perspective, that's been the case for inception, is that the relationships that we have with our tenants and the fact that they stay with us throughout a career is sticky, as we're saying, but also fundamentally important for that long-term perspective on how we approach, the ownership, the management of our real estate, knowing that, there's lower probability of turnover.
Mm-hmm.
And when there are tenant changes, it's usually, selling or transferring of practice to another practitioner, but who is looking to continue, he or she, in that space to then carry on with their career. So there's been lots of iterations within practices across our real estate, and so it's the stickier investor, stickier tenant, I think, is very much aligned with what we're looking at doing longer term.
Yeah, lots of change with portfolio and geography, as well as the senior leadership team, and narrowing to the Americas while your shareholder base is predominantly Canadian. That's no retreat. I think that's just discipline, right? Focusing where you actually have conviction and proximity, rather than just spreading reach for its own sake. Now, what makes healthcare real estate such an attractive asset class to build a career in, and also to invest in, Dave?
You have the full benefits of commercial real estate. You have your big buckets. You have the full benefits of that. I would say it's not as well known and sort of tracked and followed. So you have the ability to do some things within healthcare real estate that you may not have the same ability across different asset classes. But I'd also say that, much like our tenants, you can build a long term career here. Furthermore, I would go in so far to say that we're a real estate investment trust. Obviously, we're in the real estate sector, but we do spend a lot of time trying to understand what our healthcare tenants need and want. And I'm not trying to brushstroke this. I know that a retailer here is not the same as a retailer over here, or an office tenant here is the same as an office tenant over there. But we have very unique requirements in our buildings as a result of the type of tenants that we work with, that really allow you to sort of get under the hood, so to speak, and understand a bit more about the real estate. It's not just a person that's in leasing. Yes, that's their main focus, but they learn quite a bit about operational impact, or the property management side of the business, because we need to be bringing everybody together to work with our tenant base. And then it's where the tenants are, recession resistant. That people come to them. There's always demand. So cyclical. Those ups and downs and cycles. They're a bit less impactful to us. Not the highest peaks, not the lowest troughs here, but there's always movement and activity happening, something to do in our buildings. I guess I would say. And again, that comes back to those tenants building their career here, wanting to be here a long time. And then if that piece is attractive to, a prospective employee or someone that's looking to jump into the business, then there's a lot of alignment there. There's a piece of it that our assets play a part of how healthcare is being delivered in this country and in the geographies that we participate in. You have to come to our building to see your physician or your practitioner. And so we take a lot of pride in doing the best that we can to make sure that that environment is as professional, clean, welcoming, efficient, cost effective for the tenants as possible. So we have a role in the delivery of care.
Certainly a differentiator in terms of how you can look to build your career in real estate. And in a lot of commercial real estate, you can be successful without ever really needing to deeply understand your tenant's business. You're optimizing space and rents. In healthcare, you can't fake that, right? The technical requirements are going to force you to genuinely learn how a hospital operator or a clinic actually functions, which means, the people who thrive in this asset class end up with kind of operating literacy. You just don't, you're not just developing an office or retail. And that's probably also why capital tends to stay sticky here too, right? And investors who understand that depth realize, this isn't just a commodity asset class. It's a specialized one. And specialization usually gets rewarded over time. Moving on to the biggest misconception investors or even experienced real estate professionals would have about healthcare real estate. What's one thing people only appreciate once they've worked in the sector?
One of the biggest misconceptions, James, is especially here sort of in Canada with our existing portfolio, is that we're not an office building. We just talked a little bit about sort of the different tenants that we have, and we often get bucketed into the office market from valuation to statistics. It may look similar on the outside, but as we just talked about, what happens on the inside is very different. So I think that's generally the big misconception. What I would say that for individuals who've worked in other real estate sectors or in other professions and then come to work with Vital Infrastructure, I would say that, again, from a Canadian perspective, data, there is not a lot of public data on the real estate and the transactions within those real estates that's readily available when you compare it to other asset classes. You can go get office data, industrial data, all of the big brokerages, there are industry leaders who collect data and publish data, and you can subscribe to them, and you're going to get a tremendous amount of information. In our space, that doesn't exist because it's a smaller section of the commercial real estate bucket, and it's one where a lot of, I would say, non-institutionals have focused, relatively speaking, to institutional allocators towards real estate. If I take that same notion, James, it's completely opposite in the US. I'm just giving you some sector, what you appreciate and what you don't appreciate. We entered the US now a handful of years ago, and they have, it's a huge market. They have full services from the real estate perspective that focus exclusively on healthcare real estate. And so it was quite refreshing, but also a big contrast to Canada and the US when we were able to compare markets. The assets, again, look very similar between Canada and the US, but the US market is much more evolved and much more depth, obviously larger. That's tied to population and healthcare systems. I'm not going to get into that. But one of the bigger items that folks appreciate once they sort of understand our business or on board to us is exactly like, oh, we are the best source of data. We do have the ability to, decouple ourselves from, say, traditional office and create value differently for our investors at the end of the day. So it's a big part of what we do is how are we differentiating ourselves, spending a lot more time on educating and informing what some of those differences are so that we also get the benefit from the investor side.
Yeah, going back to the data piece for a moment, I think that's a real misconception worth flagging, because in most asset classes, the data is the easy part. It's the operating complexity, right? That's hard. And here it sounds like it's almost reversed. Not to take away from the challenges of operating these assets, but the actual real estate might look familiar, similar buildings, similar layouts, but the lack of public data means people, can't, pattern match the way they do in office or industrial. And I think that US contrast is fascinating too. If institutional players have dominated in Canada, but institutional players are dominating in the US, that tells you that this asset class is still maturing in Canada relative to the US, which probably means that there's real opportunity for whoever is investing into this asset class long term. What would you have to say?
Yeah, no, you're hitting the nail on the head here, and I'm not going to get into how care is delivered and what public and private healthcare delivery models look like, because oftentimes, I am going to reference the US, but I'm not advocating for a US healthcare system. I just want that to be clear. But what I do see an opportunity from a Canadian perspective is the continued evolution of outpatient. We're starting to see, obviously, across different provincial geographies in Canada, governments looking at other and alternative ways to deliver care. And that could be through outpatient services, hips, knees, from the surgical side, diagnostics outside of what's already available. So bringing some services out of the hospital and into outpatient settings. And then furthermore, those outpatient settings being, community-based or part of a campus of care, so that there are some synergies around, where care is being delivered in proximity to where people may be living. This very much exists in the US, as I say. The outpatient, or the evolution of outpatient medical services is 20 plus years in existence in the US, and it's starting to really gain some traction here in Canada. And so I do fundamentally believe that there will continue to be an evolution of that outpatient. It will not necessarily need to be exclusively hospital led, right? Hospitals are typically big acute centers. There will be some hub and spoke, and some systems have multiple locations. But I also feel that the population, the users of the healthcare system, the patient, are also looking for options. Wherein we spoke a bit earlier on the podcast that hospitals are often the front door, and they don't necessarily need to be. So as a patient is looking for care, they want options for themselves or for their family members. And so having the ability to go or understand that other options exist outside of coming strictly to an acute hospital, even though the service provided and there may be, hospital staff, hospital surgeons, it's just in a different location. We have at Vital, we have a number of locations and continue to actively work with the hospital sector and supporting government and issues and creating those environments where, hey, I want to take this specific service out of an acute hospital setting and move it into an outpatient, not only an outpatient, but an outpatient community setting. And so we've aligned ourselves with a few hospitals already and service providers to provide that capital real estate solution for them so that they can go and provide the services and the care that they need to take pressures off of that big acute hospital where it's arguably the most expensive real estate, and a lot of the cases that are walking through that front door don't necessarily need to be there. They can get care elsewhere, and that takes pressure off of those wait times and the delayed in appointments. So we do feel that there's a big role for our organization to play, and some factors, some headwinds that are going to support what we're actively doing from a strategic standpoint with these hospitals and other large clinical and diagnostic and surgical providers more broadly across the country.
Sounds like there is a big opportunity, and the trends are changing, are shifting.
For sure.
Yeah. As Canada is now expected to spend more than $400 billion annually on healthcare, the population is continuing to age, and the demand for healthcare services is only increasing. When you start to look ahead now into the next 10 years, what does the infrastructure in Canada need to become? And I think you've answered part of this, but again, let's go a bit deeper with that.
Sure. When I hear obviously 400 billion is a significant number, and exactly where and how that's going to get deployed across, have it be operating or infrastructure or increasing schools of medicine. Like there's long-term care beds. So there's a lot in that. I do feel confidently that our system will continue to evolve to an outpatient model. I'm not, as I say, under a public healthcare system. There are initiatives right now wherein privately run, publicly funded. So it'll be interesting to see the evolution of that. But I would say that as the pressures on our system continue with the demographics that you've just articulated, that through the government, through organizations like ourselves, and the need to practice in physical space, that we'll have the options of where this care is delivered will continue to increase. And James, I just want to take a minute here to articulate. There are a number of medical outpatient buildings that exist today, multi-tenant, where people get care and services, and those buildings will continue to play a critical role in how and where our care is provided. But there's also this advent of, as I'm saying, outpatient. If you think of like outpatient surgical, these facilities don't necessarily exist. They need to be created, right? If they're moving out of hospitals, you have MRI diagnostic centers moving out of hospital and into, you're not going into something, an infrastructure that already exists. It will need to be created. So I think from a real estate perspective, from a Vital perspective, we're very well positioned to be the group to help and support and work with these providers outside of the big hospital walls, because they're going to need space. It's going to need to come up in a relatively short period of time, and they're going to need to start allocating their services to start really putting some dents into wait times and providing services and care. Long-term care homes, same, construction development takes time, but there's going to be a pressure on trying to get these up so that these beds can be filled. So they're 10 years from now, I think you'll see a much more robust healthcare system that provides patient optionality without compromising care.
That's a confident vision you've shared, and I think it points to something bigger than healthcare policy. It's actually a real estate demand signal, right? You've got $400 billion figure. It's not just a spending number. It's telling you where physical space is going to be needed next, because the system can flex through this, hybrid, as you described it, public-private model without needing to be privatized. But every shift towards outpatient care still has to land somewhere physically. That's
correct.
A completely different leasing and development cycle than building another hospital wing. I think the organizations that can move faster with the government and operators on where that care can actually get delivered are the ones who end up owning the next decade of healthcare infrastructure, not just simply reacting to it.
The common themes across the country exist. There's a commonality in terms of some of the pressures and where care is going. I would say that some provinces are further ahead than others in terms of that outpatient model or out of hospital model, or allowing physicians to practice differently. So there's no one size fits all. The provinces are operating at different stages of where their delivery is happening, but consistently it's a common theme across. So I come back to the point that you just made is where are these services going to be delivered? Governments are investing heavily in educating the next generation of physicians. We will have a large portion of our physician group retiring or transitioning into, fewer practice days. This group needs to be ready to jump in. Are they going to want to practice in the same style and manner as their 30, 40-year experience physician? Likely not, because they're being taught differently in groups, in multidisciplinary teams. So you'll continue to see, that the evolution of that and where that happens. So we, as I say, it's a pretty invigorating time right now at Vital, having gone through what we spoke about earlier in the podcast, to be more focused on growth, on developing, on acquiring, because as I say, there's going to continue to be a need for this type of asset, this type of real estate expertise in the market.
Yes. And bringing the question inside of Vital, what role does Vital Infrastructure Property Trust want to play in the next decade?
We want to ensure that the hospitals, the government, the clinics, the groups that are looking to, fill in the blank, solve some of these delivery problems, that we're there to be a capital partner. We have knowledge, we have the expertise, we have the experience to really work with them and execute on sort of the physical side of what they're envisioning on the operational clinical care side. Hospitals today in Canada are owned or public entities, but where care is delivered, I think that there's a real role for our organization to play to support the continued growth and expansion of that physical footprint on where care is being delivered.
I think that's a clear and confident positioning. And what stands out is that you're not trying to be the clinical expert here. You're trying to be the essential partner who makes the clinical side possible. There's a discipline in that, knowing exactly where your expertise will add value, the capital and the physical execution, and staying out of the lane that belongs to hospitals and governments and government and public entities. And I think that kind of focused partnership model is probably exactly what makes you valuable to work with, rather than competing with.
Agreed.
We've arrived at the final stop, the last question of the podcast. It's been a great conversation, round two. And I do thank you for all your insights. And it's been great to get deeper into the fabric of healthcare real estate on this second round. There's probably people listening to this podcast who are working in the office, industrial, retail, or multifamily or development. And after spending more than 20 years in healthcare real estate, if you had to give our listeners just 3 reasons why someone should look to build a career in healthcare real estate, what would those 3 reasons be?
I would say you've named, the bigger commercial real estate buckets. We play in that space, just a bit more of a specialized. And so for, those individuals who've been looking to still be in commercial real estate, have the exposure to that side of real estate, but in a more specialized approach. We are that organization. As I say that, we do invest a lot of time in that partnership, that relationship side of the business. So there is a bit more of a stronger focus on understanding. We've talked a little bit about this on the podcast, understanding what our tenants and what those hospitals are looking for and need. So again, it's a bit more specialized and focused. And I would say if those points aligned, myself personally and others in this organization, and I touched upon it earlier, there is pride in what we do because of the role that we play in the delivery of care. And if you fundamentally have alignment with what you believe in, and then how you sort of execute and participate in what you believe in, there is that opportunity. We as an organization support and play a piece in that, and take a lot of pride in doing that.
Thank you for listening to People Who Perform, the Real Estate Careers podcast brought to you by Highview Partners, a talent search and recruitment firm focused exclusively on Canadian real estate. If your real estate team is looking to find the best next hire, or if you're ready to make the best next move in your career, then reach out to Highview Partners today. Follow us on LinkedIn and visit us at highviewpartners.ca.